Hello and welcome to this presentation regarding an introduction to the Joint Commission, inside the survey and beyond the standards. Here is a quick list of what we will be discussing today. We will talk about what surveyors are looking for during a survey. We will look at some things that promote non-compliance and where surveyors look for it. There will be a list of typical patients that surveyors want to trace, and what to do when a surveyor shows up in your area. What is the main goal and driving factor behind the work of the Joint Commission, also known as TJC? The Joint Commission was founded on improving care and doing the very best job we can to take care of patients. This can probably be best summarized by the term patient advocacy. The goal of the Joint Commission is to ensure quality healthcare for patients. The Joint Commission protects the welfare of patients by looking at how well organizations prevent harm and promote best practice. As you may imagine, all aspects of patient safety are very important. This also applies to activities regarding continuous improvement throughout the organization. Certainly, teamwork and innovation play an important role as well. Here are some examples of each. It should come as no surprise that most of the Joint Commission standards deal with patient safety. Quality care includes the elements of S, T, E, P, which states that care must be safe, timely, effective, efficient, equitable, and patient-centered. Quality care must be safe. The Joint Commission knows quite a bit about an organization before the surveyor arrives for the survey. For example, the application provides lots of information regarding the organization, including the types of services, hours of operation, locations, patients' volumes, and more. Surveyors also often look at the website of the organization before arriving as well. They also have access to how well an organization is doing with core measures. Websites such as Hospital Compare also provide some insights into the performance of an organization. So, what is the bigger picture of regulatory compliance and how do surveyors know where to find the issues so quickly? Here is one way to look at it. Avitas Donabedian, a performance improvement expert, said that structure leads to process, which leads to outcome. Using that analogy and a flow diagram, you can see in this example how common healthcare activities and operations fit within the structure, process, and outcome model. Certainly, the alignment and integration of these activities and operations are essential to a comprehensively patient-centered organization and compliance with many regulations. Here are some examples of commonly cited clinical standards that are often the result of not following policy or not providing complete documentation. When thinking about the previous slide, these citations are usually the result of a disconnect within the processes of the organization. Other common areas of regulatory citations often involve recent regulatory changes and areas of current patient safety emphasis. Here are some examples of areas of concern. Surveyors also know where to look in areas of common challenges for compliance. For example, there is often process variation found within high-risk, but low-volume procedures. If a particular procedure is not performed frequently, then it is more likely to have a degree of variation in practice. Surveyors also find non-compliance with standards when proactive measures have not been considered to protect patients from specific types of harm. An example might be, what is the plan to safely evacuate a comatose, very overweight patient from the 5th floor of the hospital? Other major areas of non-compliant regulatory citations are found in not following policy or procedure, and incomplete documentation. Policy should be written as generically as possible to accommodate safe variations in some practice. Likewise, if a policy, procedure, or regulation states specific documentation requirements, for example, pertaining to restraining a patient, it is important to have an associated process to prompt and promote compliance with documentation requirements. Also, consider other factors that promote non-compliance and medical error. Several examples of this are provided here. Some of these pertain to sentinel event alerts, others are found in current literature. Process variation, which often results in a citation regarding not following policy, and communication issues are frequent areas of findings, and often also found in root cause analysis following a harm to a patient. A quick study in human factors can produce many examples of how to enhance compliant performance, improve patient safety, and reduce medical error. A few examples are provided here. Please take a moment to read this statement. Keep in mind that continuous compliance with standards from the Joint Commission is a minimum expectation. Here are some common questions about survey. When will they be here? Why will they be here? What are they going to survey? Here are some typical characteristics of patients surveyors often want to trace through an organization. Surveyors are usually interested in following or surveying these types of patients. Again, they also often look for high-risk and low-volume type of procedures or patients. Here is some good advice if you are a manager and a surveyor shows up on your floor or area. Be kind, concise, and available to help. Provide only what is requested from the surveyor. Here are some common questions asked of caregivers and managers by surveyors. The surveyors will expect that you have these operational answers ready as these are common issues. The last question about an active shooter is unfortunately becoming a larger risk in hospitals across the country. And here are some common types of questions asked of leaders of an organization by surveyors. So, as a brief preparation for survey, would you know what the acronyms on the screen mean? How would you answer this question? Do you know where to find the answers to these questions in your organization? It has been my pleasure to provide this introduction to the Joint Commission, inside and beyond the standards. I hope this has been helpful to you. To find more resources about healthcare accreditation, visit healthcareinfosources.com. Thank you.